Hi, Mrs. Smith. My name is Jeff. I'm going to be your nurse today. Before we start, can I just check your ID band, and can you tell me your full name and date of birth, please? Okay, that matches. And do you have any allergies at all? No? Okay. Are you in any pain right now? No? Okay, good. So I'm going to be inserting a Foley catheter today. Do you have any questions or concerns before we start? No? Okay. So first I'm just going to set up my workstation. So I'm going to do hand hygiene. Put on clean gloves. And I'm going to wipe down my table. Alright. And I'm going to let that air dry for 2 minutes. Do hand hygiene. So we'll say it's been 2 minutes now and that's air dried. So now I can put all my supplies up on the table. So I've got my chucks and towel and my basin of soap and water. I've got my Foley catheter tray, clean gloves, a sterile 10 milliliter syringe, stat lock, and extra sterile gloves. Alright. So before we start, I'm just going to explain the procedure. So I'll close the curtain for some privacy. And so first I'm going to be cleaning the perineal area. And then I'm going to insert the Foley catheter into your bladder to drain the urine since you've been having some trouble peeing for the past day. And then, so that's going to be, it's going to stay in your bladder for 1 to 2 days. And there might be a little discomfort, but there shouldn't be any pain. And you will be able to get up and move about while the catheter is in place, so you won't have to stay in bed all day, okay? Any questions or concerns? No? Okay. So I'm going to pull the blankets down. All right, and then I'm gonna lay you flat on your back. And I'll ask you to open your legs a bit. Thank you. All right, so, and then I'm going to put the chucks down. And now I'll do hand hygiene and put clean gloves on. All right, and take my soap and water basin, put it on the chucks, and then take my towel, and I'm gonna wipe down the perineal area from front to back. So dip the towel in the water and wipe the outsides first. So peel back the corner, dip, do the other outside, peel the corner back, dip, and then I'll spread the labia, go on the inside on the right, spread again inside on the left, and then I'll just do one general wipe down the middle. All right. Doing okay, Mrs. Smith? Any pain at all? No? Okay, good. So I'm done with my basin. Take this off. Do hand hygiene. And I'm just gonna pull your blankets up so you're not exposed while I set up my catheter tray. All right, so I'll do hand hygiene again. And I'll get my tray and pull the kit out. And open it up. So I'll take my sterile gloves out and the bed protector, put on the side for now. And I'll take my sterile 10 milliliter syringe and drop that into the kit. Okay, so next I'm just gonna pull your blankets back down, and I'm gonna put the bed protector down on top of the chucks with the shiny side down. All right, so I'm gonna do hand hygiene and put on my sterile gloves. Okay, throw away the packaging. All right, so I'll take the tray down and I'll take the urine specimen cup out and put it on the side, the lid. All right, so I'll take the water-filled syringe and attach it to the green port on the catheter. Okay, and then I'll take the outer covering off of the catheter tip. All right, toss that. And then I'll pull the plunger out of the lubricant syringe. All right. And then just place the catheter tip into the lubricant. Okay. So now I can move my supplies down onto the bed protector and chucks. So put those first, and then the box behind it. Still doing okay, Mrs. Smith? Yeah? Okay, good. So I'm just gonna do some cleaning first. So I'll take my iodine solution, tear it open, and pour it over the cotton balls. And then I'm going to just take the forceps and use the cotton balls to wipe down from front to back and from outside to inside. So I'll start on the right side, swipe down, and on the left side, swipe down. And then I'll spread the labia on the inside on the right side. Same thing on the left side. And then one down the middle. Okay. How's that, Mrs. Smith? Doing okay? All right, good, good. Okay, so now I'm ready to insert the catheter. So I'll take the tip of the catheter and hold it about 2 inches from the tip. And get ready to insert it. All right, so I'm going to insert it slowly and gently, and on the count of 3, okay? So spread the labia with my left hand. All right, 1, 2, 3, insert, and I'll keep inserting until I start seeing urine flow, which I do, and then I'll insert another 2 inches after that. All right, So it's in there, and then I'm gonna inflate the balloon with the water-filled syringe. Push it in. All right, and then detach the syringe. And then I'll gently tug back with my right hand on the catheter to make sure that the balloon is in place in the bladder. All right. Doing okay, Mrs. Smith? Any pain? No? Okay, good. All right, so now I'll get ready for a urine specimen collection. So I'll attach the empty 10 milliliter syringe to the blue port, and then I'm gonna kink the tubing below the port, like that. All right, and then I'm gonna withdraw at least 5 milliliters of urine. Okay, that's good. So I'll detach that. And then I'll take it over to my specimen cup and carefully push it into the cup. Okay. And take the lid, put that on. And then I'm gonna label this cup with the date, time, and the patient's name. And I'll put that there, and I'll take it to the lab after I'm done here. All right, so doing okay still, Mrs. Smith? Yeah? All right, good. So I'll unkink the tubing. And then I'll get the stat lock. And I'm gonna clip the tubing into the stat lock before I put it on the thigh. All right. Looks good. All right, so just take this out and peel the adhesive off. All right, and then we'll stick it on the top of your thigh. All right, make sure it's nice and on there. Okay, and then I'll attach the tubing to the bed sheet. And then I'm gonna open up the collection bag and hang it below the bladder level on the side of the bed so that gravity can help urine flow into the collection bag. Okay, so doing all right, Mrs. Smith? Any pain at all? No? All right. So that's the insertion done. So I'll just clean up my area a little bit. All right, take the chucks and the bed protector off. I'll clean this up as well. All right, so I'll take these gloves off and do hand hygiene. Do you have any questions for me before I leave? No? Okay, so I'll just put you back in a comfortable position. So close your legs back up and sit you back up. And put your blankets back on, nice and warm. Okay. Thank you, Mrs. Smith. I'll see you later, okay? So I'll take my urine specimen, my extra supplies, and leave the room and document the date and the time, the patient's tolerance of the procedure, the color, consistency, and amount of the urine observed, and the size of the urinary catheter that I inserted. All right, so I'll throw that down. All right. Okay, so we'll say it's been 2 days and there's an order now to remove the Foley catheter. So that's what we're gonna do. All right, so knock knock. Hi, Mrs. Smith, my name's Jeff. I'm gonna be your nurse today. Before we start, can I just check your ID band and can you tell me your full name and date of birth, please? Okay, that all matches. Do you have any allergies, Mrs. Smith? No? All right. Are you in any pain right now? No? Any questions or concerns before I remove the catheter? No? All right. So, my supplies here. I've got my chucks, sterile 10 milliliter syringe, and a bunch of clean gloves. So before we start, I'm just gonna close the curtains around us and explain the procedure. So I'm gonna be removing the catheter from your bladder and see if you're able to urinate on your own now. And then I'm gonna measure the amount of urine in the collection bag, all right? Any questions? No? All right. So first thing, I'm going to do hand hygiene. Put clean gloves on. And I'm going to pull your blankets down and lay you flat on your back, and then have you open your legs up for me. Thank you. All right, so now I'll put my chucks down. Okay, take these gloves off. Do hand hygiene. And put new clean gloves on. Okay. So first thing I'm going to do is open up my syringe and I'm going to remove the water from the balloon. So I'll attach the syringe and then I'm just going to draw the water out of the balloon. Make sure I get as much out as possible. All right, that looks good. So I'll detach that. And now I'm ready to remove the catheter. So as I pull the catheter out, Miss Smith, I'm just gonna have you take a deep breath and then exhale as I'm pulling the catheter out, okay? All right, are you ready? On the count of 3, okay? So 1, 2, 3, exhale. All right, that came out easily. So I'll put the tip in the chucks and then I'm gonna fold the chucks up and leave it there. So you're doing okay? Any pain when I was pulling that out? No? All right. So I didn't feel any resistance as I was pulling that out, so that's a good sign. But if I did feel resistance, I would stop and get the syringe again and make sure I pulled all the water out, and then try again pulling the catheter out. If I still felt resistance, then I would stop and call the doctor and let them know. All right, so now I can I'll take the stat lock off of the top of Mrs. Smith's thigh. All right. Okay, so that's off. And I'll unclip from the bed. And then I'll pick up the collection bag. All right, so I'm gonna take this to the bathroom and pour it into a graduated cylinder, which I have here. And so I'll pour it in, and then I'm gonna measure the clarity, color, and amount of urine from the bag. Okay, got that noted. and then I can pour it in the toilet, flush it, and then I can throw the catheter and collection bag away as well. All right, so I'll remove these gloves, do hand hygiene. All right, doing okay still, Mrs. Smith? Good, so I can put you back in a comfortable position now. Close your legs, sit you back up, and put your blankets on, keep you warm, comfy. All right, so just a little bit of teaching after removing the catheter. I'm going to measure the amount of urine that you pee out the next few times you go pee, and there might be some burning the next one to two times you go pee, so that's normal, but it should start to go away after a few times you go pee, okay? And let me know if there's any blood in the urine, or if you have any trouble going to the bathroom, or if there's increasing pain as you need to go pee. All right? Any questions? No? Okay, I'll see you later, okay, Mrs. Smith? So I'll take my items and then I'll document the date and time of the procedure, the patient's tolerance to the procedure, and the color, consistency, and amount of urine in the bag and in the next 1 to 2 times that she goes pee.